Well, hey there, it's Dr. Brian McKay, Core Health Darien, not just a chiropractor now, to Stanford Darien, Norwalk, New Canaan. And yes, it's probably the worst possible name for a podcast. But if you have frozen shoulder or adhesive capsulitis, this might be a good place for you to listen today. All right, it's April 8th, 2022. Hopefully, you're having a good day. What I want to talk today about is how pulse shockwave therapy works and why it's particularly effective for shoulder pain. And really difficult shoulder pain is called frozen shoulder or adhesive capsulitis. I know I'm throwing a lot of big terms at you, but if you had chronic shoulder pain for a long period of time, it's hard to raise your arm above your head, hurts tonight when you go to bed at night, you can't sleep properly because it's so darn painful, and your shoulder basically isn't working, and you're reaching out for Advil, Aleve, maybe you go for cortisone shots to relieve the inflammation. But I want to tell you first that for the majority of the time, the muscles that we have found that are involved with adhesive capsulitis, aka frozen shoulder, is going to be the latissimus dorsi, supraspinatus, subscapularis, and the middle deltoid. So this is what we're finding on a large, regular basis, much regular basis. All right, so let's explain the muscle groups. The lat, latissimus dorsi, is basically this large, flat muscle on the back. It stretches to the sides behind the arm, partially covered by the trapezius, and it's a big muscle. Okay, it's used the muscle. The lat's basically for extension, abduction or adduction. I'm sorry. So it's kind of like moving your. It anchors the shoulder down in a very very big way. And what happens here is you have it's a muscle group like bodybuilders are going to work the heck out of it. And it's also the largest muscle in the upper part of your body. So it goes from right underneath the deltoid all the way down to your to the lower thoracics, and it's a big broad muscle. It inserts on top of the almost to the bottom of the iliac crest. So sometimes people got hip pain, the lat's involved. I see that from time to time. So lat is a big player in pain. The fact that it's near the deltoid, tucked underneath the deltoid, would make sense that these muscles and groups are involved. So, like I said earlier, you have the latissimus dorsi, supraspinatus, subscapularis, and the middle deltoid. So, hopefully, you get a good understanding of how broad this problem can be. And it's not if you go to typical therapy. If typical therapy doesn't work, what are your options? Is it surgery? Well, if it's not a tear, it's really not a surgical resolution. The Advil and Aleve, there's only so much Advil and Aleve you should be taking, and basically what happens when you have it for a long period of time, the muscles start to fail, and this frozen shoulder kicks in. It just means you can't move your shoulder. Not a good thing, and a very very painful thing. Imagine trying to drive with a shoulder that's not working. Imagine trying to hit a golf ball or a tennis ball. Imagine trying to lift weights. Okay, that's another thing. So there's a lot of stuff to consider with just the latissimus dorsi in and of itself. But the fact that the relationship with the deltoid and the middle deltoid is where we see the most of the problems with, as far as what we find that being weak, we got to tie all this stuff together. And that's what I hope to do today in this podcast. All right, let's touch upon the supraspinatus. Supraspinatus is not a particularly big muscle. It also happens to be one of the rotator cuff muscles. And to think of the supraspinatus, it's like I said, not very big, but it kind of prevents wear and tear on the head, the actual head of the glenohumeral head. So what it does is it performs abduction of the arm and pulls the head of the humerus inward. Okay, so it prevents the head of the humerus from slipping out of place. But the supraspinatus works in cooperation with the deltoid muscle to perform abduction, which is that motion of moving. If you locked your arm into a 90-degree angle and you bring it away from your body, that's the deltoid. So you can see how these are related. And I'm talking about, just for the majority of cases, these four muscles that we're talking about are the ones that you want to pay attention. And again, you know, at the end, I'm going to repeat several times the four muscles that if you're not getting relief from whatever treatment you're doing right now for your shoulder, it would be in your best interest to go to your therapist, your doctor, and say, hey, I want these muscles checked out, because it could go a long way to resolving your problem, and it happens very quickly. I just had a patient who went through a long spell of shots, therapy, Advil, Aleve, not sleeping well at night. And he's going fishing with his son, and he was afraid he couldn't move his arm. So out of desperation, his wife made the appointment. He came in, and 3 days later, he's going out of here free of shoulder pain altogether. Now, am I bragging? No, I'm just actually thrilled that this guy is going to be going fishing with his son, and stuff like that really has me thinking about making people more educated about these different muscles. So now let's test. Let's touch on the other muscle, subscapularis in the middle. The middle deltoid. Again, big players. So you got the lats, supraspinatus, subscapularis, and middle deltoid. Let's start with the subscapularis. All right. So the subscapularis. This is one of the only shoulder muscles that's in the front. So the scapula is that big triangular bone that if you reached over and patted yourself on the back, right, that big bone there. But in the front, or more internally located, is the subscapularis. And so what the subscapularis does, it moves inward rotation of the head of the humerus. Okay? It's a pretty broad muscle, pretty big, and when it gets worked on, you'll feel it because it can be quite painful as well. But it also pulls your arm back to your side. So before I said I was talking about like how the other muscles work, especially the deltoid, and now I'm talking about, so the deltoid would move your arm away if you put your arm into a 90-degree angle. That now the subscapularis, it would help bring that arm back. So if you would again put your arm into a 90-degree angle, move the arm away, now you're pulling it towards. That's one of the actions of the subscapularis. By rotating the head of the humerus, which is the arm bone, it brings it downward and forward. And it's a pretty big defense muscle as well, because it prevents the displacement of the head of the humerus. So if you're ever fallen on your shoulder, you took a spill on the ice, maybe you got tackled the wrong way, the subscapularis could be involved. And we find typically that muscle contracts. When it contracts, it limits your motion, which is why they came up with that name, frozen shoulder. Your shoulder's frozen, it's not moving properly. So again, it's good reason why to be aware of it, especially if you're stuck with, not getting answers for your particular shoulder pain. And shoulder pain is not fun. Well, there's no such thing as any pain, it's fun. But that's the subscapularis. So now I want to touch upon the middle deltoid, and that's another big player we find with shoulder problems that are often misdiagnosed. All right, so the middle deltoid. Here's how you're going to know where the middle deltoid is. Basically, if you put your hand on your shoulder, you're going to be hitting it. If you took the jab recently, got your vaccine shots, chances are they injected you in the middle deltoid. That's a little fun fact that doesn't really make too big of a difference, but in case you're trying to find that muscle, if you palpate it, should also be pretty obvious to find. So it's kind of that cap on the shoulder. And like I had said earlier, what we find is that muscle becomes weak. So how they all play, that all these muscle groups are interrelated. And that's how we have to understand where shoulder pain can arise. And most commonly, it's these four muscle groups. Again, the latissimus dorsi, supraspinatus, subscapularis, and the middle deltoid. We started using a additional therapy besides addressing the contracture of the latissimus dorsi and contracture of the subscapularis with the weakness of supraspinatus and weakness of the middle deltoid. And we started using pulse shockwave. And what pulse shockwave does, it breaks up adhesions that form in tissue. Now, adhesions will start from a trauma, repetitive sprain strain. So if you fall on the ice, if you, again, get tackled playing football, however, there's many different mechanisms of how you can do it. Also, too, is repetitive sprain strain. If you're a carpenter, you use your hammer all day long. Well, you're taxing the muscles, but typically that's not going to aggravate it. These muscles have to work in coordination and move properly. So when it doesn't do that, these adhesions form in the fascia. Now the fascia is a very nerve-rich covering to the muscles. And so what happens typically is the tissue, due to trauma, repetitive sprain strain, are going to, instead of being nice and smooth, you get pocks. It's like potholes. You see a brand new street and you see potholes. Those potholes are kind of in your head to picture what an adhesion is. Now, the adhesions prevent the smooth motion, just like if you have potholes in the street, your car's not going to ride over it smoothly. Well, it prevents the muscle fibrils from moving because the covering contracts. Pulse radial shock wave breaks up those adhesions. It allows the adhesions, the tissue now, to form in a normal fashion. So it's kind of like taking a big eraser or taking taking some asphalt and filling those potholes. But I wish I came up with a better way to describe it. But if you can, hopefully you have a better understanding of what I'm trying to describe with this podcast. So the pulse shockwave allows for also a process called angiogenesis. Now, angiogenesis is it restores blood supply. It stimulates these tiny shocks, and they're not really painful. I mean, the only time pulse shockwave would be painful if you're on the bone. It doesn't really belong on bone. But if you have a practitioner who's using it and they're not really experienced, they may hit the bone. You're going to feel a little bit of pain. But this gentle pneumatic tapping, again, breaks up adhesions or scar tissue. And adhesions are very much like scar tissue, but more on the micro scale. Um, and now you have increased blood flow to help heal that fascia level. So it's a very, very effective tool to mitigate shoulder pain, especially frozen shoulder, aka adhesive capsulitis. So I hope you learned a little bit today, but if you're having reoccurring problems with your shoulder, it tends to get worse. I mean, some people have what's called frozen shoulder. The shoulder doesn't move properly, sleep goes out the window, more pain, less sleep, more pain, and you get into a kind of a downward cycle. Not a particularly good thing to have, but that's what you're up against. You find a practitioner who's not listening to you, and you say you did physical therapy, it didn't work. Identify these muscles for them. I mean, the therapist would know. I'm not telling you any muscles that any doctor or therapist, but if you're not looking for these specifically, you can have a quicker solution to your problem. Now, if the therapist or the doctor you go to has shockwave, and then you sit there and say, listen, check my lat, check my subscap, my supraspinatus, and the middle head of the deltoid. Get those things worked on and see if it doesn't make you feel better. I was thrilled today, this guy, to go fishing with his kid again and not have that pain. It's definitely a rewarding feeling. And again, I'm not trying to brag, but it's just a great feeling when someone comes in with a problem, you're able to solve it in, in this case, 3 visits. So it's fun when you get people out of pain. It's not fun they're in pain. I don't want you to get that in your head, but basically, if you're having any issues, you got a question, you can reach out to me. I'm more than happy to call you back. I'm in Darien, Connecticut, right near Stamford, Norwalk, and New Canaan, hence the name. My town's right in the middle of those 3 areas as well. Give us a call, 203-656-3636. 203-656-3636. I'm Dr. Brian McKay, not just a chiropractor, Stanford, Darien, Norwalk, New Canaan. Hope you learned a little bit today, and I hope you come back to my podcast again. Thanks a lot. Have a great day.